So we have a case. She came with a severe breathlessness. And what was the most interesting thing? A 16-year-old girl saw an accident, a very bad accident. And remedies are going to be very simple. Please, homeopathy is very simple. Don't complicate it by adding different shades and colors of your personal prejudice. Okay? As soon as she thinks about this accident, she started feeling breathlessness. There was a lot of breathlessness which would keep on coming suddenly. But when I auscultated this patient, there were hardly any abnormal sounds. She went from one doctor to another. Nobody was able to relieve. They would prescribe her lot of medicine, the bronchodilators, the pumps, and but nothing could relieve. They could not find anything wrong with her. What is the remedy? Good. So we have to toss between aconite and Ignatia. Why Ignatia and why not aconite? Can somebody say? Yes. The shock, sighing, and emotional. This is what makes it Ignatia. See, if it was aconite, friends, it would just be at the first stage. But now the disease has become chronic. Aconite is a wonderful remedy if it was within the first 24 hours or first 48 hours or first week. But it is gone very deep. It has made an impression at the subconscious level. So already the acute phase is gone. Understand? See how you perceive. So she has been to many, many physicians before she came to me. There was nothing wrong. The patient was given Ignatia. Sensitive disposition, hyperacute. Ignatia is frequently required and is especially suited to sensitive, delicate women and children, to hysterical women. You will not cure the natural hysterics with Ignatia, but you will cure those gentle, sensitive, fine-fibered, refined, highly educated, overwrought women in their nervous complaints with Ignatia when they take on complaints that are similar to such symptoms as come in hysteria. See how beautifully Kant has described Ignatia. You get this picture live in front of you. Dwells upon the cause, the state keeps on recurring. Dwells upon the cause. Her subconscious would think about the accident. She would just subconsciously think of accident. And every time she would have that ache. That is homeopathy. Until the irritation is so great and the cough is so great that she goes into spasm. The psychological aspect, there is no expectoration. It was more in the acute phase. So the patient was given few doses of only Ignatia 30. Yes, LM potency can work, Parveen. LM potency can work. But sometimes LM potency is difficult to manage. The patient was given Ignatia 30, 2 pills as and when she required, and stop when she was better. See how beautifully it is written by Phatak. Other causes, ill effects of grief, fright, worry, disappointed love. Deep breathing without any rhonchi, rals, or any symptoms. So learning the complete deep understanding of a remedy. It is important to know the causative factor